Hello, hello. Good morning in Japan and good afternoon in California. Good evening on the East Coast. It's Japan Zoominar from UC San Diego. I'm Ulrike Schaede, professor of Japanese business and director of JFIT, the Japan Forum for Innovation and Technology. Yes, this is at the School of Global Policy and Strategy at UC San Diego. If you're interested in our school, perhaps because we have a degree in international affairs with a Japan specialization, please check us out. And our website is gps.ucsd.edu. And our Japan Center is at jfit.ucsd.edu. If you go there, you find a number of tabs, including the news and media spot where you can sign up for our half tongue-in-cheek San Diego, Japan newsflash, which we write every other week or so. And if you go right next to it, there is the Japan Zoominars tab, where you can listen to previous recordings and sign up for future events. Yes, that's right. This event is being recorded and it will be on YouTube through our Japan Zoominars link later. Feel free to type any questions you might have into the Q&A box while we go, as we go. I will refer to you only by your first name to protect your privacy. So today, of course, we have Sarah Loveman, who I will introduce momentarily to talk about aging and Japan as a trailblazer in aging. But let me alert you that in 2 weeks from now, my dear friend, co-author, former colleague, and still colleague, Takeo Hashi, will join me to discuss what's going on at the Bank of Japan. Of course, everybody is looking who is going to be the next governor, and we'll discuss what kind of policy choices this person actually has. All right, so today we're going to talk about aging. And before I turn this off, I wanted to alert you that Sarah Lubman is the author of a piece in the National Geographic, which just came out this month. So it's still warm from fresh from the press, so to say. And it's a fabulous piece with great photography. And she actually managed, and I'll congratulate you on this momentarily, Sarah, to make a topic that we thought we all knew a lot about, fresh and new and interesting. So let me stop here, and here she is. Hello, Sarah. Good morning, good evening. It's great to have you.
Hi, Ulrike. Thank you so much for having me. It's great to be here.
So let me see whether I can introduce you without messing it all up. You have so many accomplishments. So Sarah Lubman is a fellow Japanologist. She has a BA in Japanese and Religious Study from UC Berkeley, go Bears, and an MA in Japanese Literature from UCLA. So this is a UC affair here today. She spent almost all, if I understand it correctly, of her life in talking, thinking, and writing about Japan. There was a period of time where she worked as a corporate communication executive with as a consultant on how to communicate, but also in the SoftBank communication department group. That's a whole different topic we might have you back for. And then she's a veteran journalist, having worked for almost 20 years on Japan and China and Asian affairs. So Sarah, thank you for joining us. And then I should say this National Geographic piece, which I just showed, is absolutely fantastic. It's beautifully written. It has great photos. It made me laugh. I did not know, Sarah, that the Yakuza is facing a labor shortage, and that the majority of Yakuza are now over 50. And it's like, usually recessions are good for organized crime, but apparently not in this country. And then also that the entire country is one big living lab now, trying to get ready for this. So thank you for joining us.
Thanks so much for having me. And it means a lot for me to hear you say that about the story, because as we were talking about earlier, especially if you've spent a lot of time, if you're a Japan expert, I wouldn't think there might be much new for you. So I'm glad that there was something new. I'm glad I amused you, and thanks a lot for reading it.
So Sarah, let's start out maybe. So what you spent? I don't know, a year maybe on the story, half a year. You came to Japan. So if you look on this, so I mean, let's start first with why Japan is aging so fast. And so there actually, as you point out in your article, I think there are 4 aspects. You point out 3. One is life expectancy is incredibly long. which is an interesting topic, right? So diet, healthcare, maintenance. So there's actually a contribution to this, right? This is not a happenstance. Low fertility rates, which is not something that's special to Japan, but just started here maybe a little earlier. I don't know. You mentioned limited immigration, which would make other places, including the United States, younger, right? And then I would add to that, it's just such a safe place, right? So there are fewer bad things. There are fewer drug overdoses, fewer homicides, fewer car accidents, fewer all of that. And so this society lives a beautiful, long life. But can you talk a little bit more about what this age? Give us some context about this aging.
Sure. Well, let me back up a bit by explaining why I wanted to write this story in the first place. So yes, I was a journalist for 17 years. I probably about a third of that in China and Japan. Then spent the rest of the time in the US. And then, as you mentioned earlier, was in corporate communications, counseling Japanese companies. So, I've been, a lot of my adult life has revolved around Japan. And I've long felt that Japan doesn't get enough of the right kind of attention. So yes, everybody knows Japan is aging, kind of, so what? But what fascinated me, and I was lucky over the past 15 years to go back and forth to Japan a lot because of work. So that was interesting. I was there as a student, as a graduate student, and starting off in journalism in the bubble era, which I know dates me, and then had a bit of a hiatus and then started going back a lot, I guess, in the mid 2000s, up to the recent present. And so when you are going back and forth a lot, you notice things. And what first caught my eye, I guess in the mid 2000s, was I started noticing these interesting icons outside public restrooms. I don't know if you've noticed it. It is a silhouette with a plus in the abdomen. And that is a symbol for an ostomy toilet. Okay, so this took me a while to figure out. And I would ask other people, do you know what that is? And they didn't, both Japanese and non-Japanese. And it is, of course, tied to aging. I mean, there's also high rates of stomach cancer in Japan, so it's probably linked to that as well. But those two are tied together, and people live longer, as you said. And then I went down a rabbit hole and discovered that if you have an ostomy bag, you can search every train. There's a whole website, and you can search and find out by train station and by prefecture and by highway stop, where are these ostomy toilets? They're now on the bullet trains as well. Or when I went to Japan, I would always listen to the news in the morning. And I think I say this in the story, it's like the weather report, where you hear something about aging society. And every time it was some different aspect of it. It had to do with property, or it had to do with dementia, or it had to do with housing, or some new food product. And so you just get what I was interested in trying to capture, which is hard in one story, maybe impossible, is the cumulative and overlapping ripple effects of aging in Japan. I was interested in how that's changing Japan, and also in how the business community, both I would say sort of localities and the business community, are reacting and adapting to that. So that was why I wanted to write the story, was to sort of explain to a broader audience that doesn't religiously read the FT Japanese coverage, which I think is great. I think the media does a good job of writing about aging in Japan, but they're doing it by necessity in sort of small installments. And I wanted to try to step back and say, here's why Japan is relevant. Don't dismiss it don't get fixated on the fact that GDP is lower than that of China, for example. And don't get fixated on Japan as somehow less important. It's more relevant than ever.
So there is an aspect to this, I'm just now reacting to what you just said, about caring and being yasashi and helping and so forth. Is this just calculated social policy, or is there also we have to be good about this because there's a kindness, a Japaneseness around setting up these things? I mean, the public installations are amazing, right? I mean, on the other hand, you can't really use a subway if you have a bad knee, but that's maybe a different story because there are so few escalators. But where they build new things, there is in the construction of it, there is there seems to be always a concern about this, right? Which is also a very nice aspect of the society, isn't it?
Yeah, I don't know. I mean, nice is one way to put it. I think it's out of a sense of duty. You've got to take care of these people, right? So yes, I was also fascinated by the extent to which urban design is factoring in aging. And there are a lot of people thinking about how do you engineer housing? How do you engineer town planning to increase social participation? There's a lot of experimentation with that I think is really fascinating, alongside the kind of market opportunities.
So a lot of people you mentioned who even those who read the leading U.S. news outlets regularly don't really know what the situation is. So let's maybe talk a few data. So I've hear this. Everybody in Japan is old. No, 71% of people in Japan are still younger than 65. So 29% of Japanese are old. If you are only in Tokyo, you would not know it, right? Because
Correct.
as you report, only 23% of people in Tokyo are older than 65.
Yeah, but
I was shocked by that.
Nationwide, it's almost 30%. And then the projection is that by 2060, it'll be 38%. And obviously people, yes, the large cities, the balance looks a little bit different, but you definitely notice it in the countryside. The farther out you get, you notice it in parts of Tokyo as well. It depends where you are. If you go to some kind of older sections of Tokyo, in fact, it was at one of those, I don't remember the name, I had met a 95-year-old incense seller. I was going back to interview him for the second time. And by the way, he did not want to be interviewed at all. He wasn't interested in it. Was his family incense shop. And I said, what did you do before this? And he said, it doesn't matter. But it was on my way to see him where I looked down at the train platform and saw that there was a place to put your cane right next to every seat. And not only that, there was a little etching of a cane on this little metal notch to make it absolutely clear for anyone who's doubted it that is what it's for. So there are parts of Tokyo as well that I think you can see it, and even Toyama, I'll say, you notice that there are not a lot of people around. It feels a bit deserted.
So actually, we have the Q&A already coming in. Rick wonders whether this is one of these stories, right? And so, true or false, that there are parts of Japan or towns where people have not seen a child for years. I don't know. True or false? Yeah. Is that widespread? And if so, what do you think the psychological impact of this is to the people who live there? What did you find? You went to Toyama, right? And so you write about in your story.
I went to Toyama. I guess I can't speak to that in too much. I mean, what I can talk about is I went to Iwase, which is the opening scene in the story, which is this kind of northern part of Toyama that's older and kind of hard to access. And I spent, and this was actually sort of an accident. It was the current mayor. I went to talk to the former mayor of Toyama, who's credited with putting in this infrastructure that made it easier for older people to navigate. But I also met with the current mayor of Toyama because it wouldn't be polite to only talk to the former mayor. And he mentioned to me, by the way, there's this service, mobile grocery service that delivers to these remote parts of Toyama. And of course, it's Japan. So there is a schedule and a map, and you know exactly when the truck is going to go and where it's going to be. So I went there and waited, and it really was as described in the story, where the streets were empty. And then right before the truck shows up, people start kind of poking their neck out and looking for it. And those people are all old ladies. And there were no children. And I noticed walking around, because, it's a fairly small area. There were no stores. There were lots of medical clinics. There were dentists and clinics, and that was kind of it. So I can't really speak to what the psychological impact is. And I will also say that I've heard, yes, there are all kinds of incentives being offered to try to get people to have more kids. I'm sure you saw just recently that Japan is offering more money to families who have children and who move out of Tokyo, I think it was. From what I've heard, those kinds of financial incentives don't really have a lot of impact. And also, I was not focused on the shrinking population, on the fertility decline. I was focused on the opposite issue of old people living longer.
And I think those actually, I mean, they're obviously they're
related.
Related in terms of the population pyramid, but they're actually two different.
Totally. And I wasn't focused on that.
I appreciate that you didn't throw that in there, because it would have just distracted. I want to talk about some on the ground things. So your story about the little truck coming, when then the old lady buys a cucumber and a tomato, and then, you know, that's great. But you had also a story about Machizukuri, which immediately caught my eye, because I, of course, as a business scholar, I talk a lot about monozukuri, which is the art of, you know, manufacturing and making things. But you are talking about machizukuri, which is the art of creating I don't know, even I forget how you.
I know, it's really hard to translate. It's
creating a new community or a new.
It gets translated. I mean, community building, I guess, would be how you might translate it. It's when I've seen it translated as town planning, but I don't think. But that is a literal translation of machi that doesn't really work in English, right?
No, because it's an existing town, right? And it's the art of turning this existing town, if I understand you correctly, into a place that is easy to live and inclusive for older people.
Correct.
Right? Something like that.
Correct. In that case, yeah. I would call it community building. And look, there's community building in communities all over the place. But what seemed particularly Japanese about this one was, I write about it in the context of Kamigo Neapolis, which is one of 60-some, complexes built by Daiwa House. And where
they built this new, sorry to interrupt, they built this new, or is this
no, it was it's a planned community. It's all single occupancy homes, single family homes rather. So not a big danchi, not a big apartment complex, but single homes. And it was built, I think it was the 70s. I don't remember exactly, but
it's on the way to Kamakura, right? From Tokyo South?
Yeah, right. Kind of up on a hill. And what was interesting about this place, and I first read about it actually in Toyo Keizai, and then found out that Daiwa itself had written something about it. And so I contacted them. I was interested, is that this was a community that was built for young families, young families with young children, rather, where the men were tending to commute. But the whole community aged, and their proportion of older people was higher than 30%. I don't remember exactly what it was, but the community that was built for these working families didn't work anymore for the population that's still there. And so they started asking for things. They started asking, Daiwa saying, this doesn't work for us anymore. We have no place to go. We have no place to congregate, because all the stores in the neighborhood had closed. So sort of similar to Iwase, where there wasn't any glue to kind of hold the community together. And so they started lobbying for it. What Daiwa House did was modest. I mean, there was nothing revolutionary about it, but they created a sort of community center that also had a little grocery store in it. And it has chairs and it has tables, and people set up, and an ostomy toilet, and people set up things like a service to go around checking on the oldest people in the community. So to make sure, are they okay? Do they need anything? They set up their own newspaper. There's the Machizukuri News. They have little jackets printed up. They have a little insignia. I mean, I don't think maybe you would find that in the US, but I'm not sure. And of course, there's like the chairman of the Machizukuri committee, but they're very earnest and still thinking about what other services do we need. And one of the things they would love to have is a clinic on the property. Is that possible? And again, sort of what serves the current population rather than the past.
So you wrote about this as a distinctly Japanese way of a bottom-up thing. And there's actually a protagonist in your story who's building this, who's leading this Machizukuri movement in Kamigo. Are these people doing this again out of the goodness of their hearts, or are there government programs? What's the government doing on this?
That's a good question. And the local schools had closed as well. I think people did it because they felt isolated. That's what I heard a lot. People felt isolated and sort of cut off and without a place, there was no place for them to gather. So I think it was kind of a social need. There were a lot of discussions with the government. I mean, it took quite a while for this to come about. And there, by the way, just to digress for a minute, there are all kinds of other interesting housing experiments going on. For example, there's a very interesting professor at Todai who's an engineer who specializes in architecture. And what he's most interested in is housing design engineered to increase social participation. He gave an example of housing that was built by a nonprofit in the post-tsunami zone, where they had this older population, but they didn't want to just put them in temporary housing. So the housing, it's for older people, I would say, who don't yet need a high level of nursing care. There's 5 different levels of nursing care in Japan, from a little bit to basically bedridden. And so they created a housing complex with a shared, where all the rooms are linked by a shared veranda, so that every room has access to the outside. So you're not just seeing people when you go in and out of the building, but also people can walk back and, they can encounter each other on this veranda, as well as a walking path that's parallel to the veranda. And again, it was, how do we get people interacting with one another? That's one. There's a private company called the Asia Investment Partners. I spoke to them. They have a Japan subsidiary, and they are building, it's a real estate investment firm. They're building kind of mixed use housing in urban areas. So they've got one in Tokyo for 100 people capacity. But it's not far, it's in Chuoku, so not far from Ginza. So the top 5 floors are a licensed nursing home. Then there's a clinic and a pharmacy, and then a retail store and a supermarket all in one building. So if you are an older person and you kind of like an urban environment, you don't really want to go just be isolated in some facility, you can still live, independently and have the benefit of other services. They have another one where in the same property, there's a daycare and a nursing home. So I think that's an interesting concept, rather than isolating people with other old people.
It also answers Rick's question, right? So 3 generation, 4 generation interaction is actually very healthy for everybody. So
right. So if that's not happening organically, how can it be encouraged or fostered, rather, in another way?
Yeah. So we were talking about Toyama, and Edward has a question that we actually also just discussed briefly, which is that in places like Kochi and Shimane, there's a conscious effort to move old people into towns because government health service cannot extend far enough. And we had this discussion about, there's the image of these staged stalls and schools, and people are making people up, right? And so that they're not so lonely. And every time I see that, I'm thinking, well, what's wrong with just exiting those areas? What's wrong with nobody living there? Right? So if that city or that place or this faraway place in Kochi that Edward is thinking about, if no people are there, then what's the problem with that? Let's give it back to nature. Let's return it to nature and have, foxes roam or something like that. And what's wrong with that? Is this just another expression of Japan being unable to exit?
I think that's fine in theory, but think about it. There's a long, thin tail before that actually happens. So it takes a while for a community to die out. And actually in Toyama, I did speak to, the person who was providing the care is quoted in the story, who goes out and makes house calls to people in the more remote areas. That was why they made the changes to Toyama, but they did to encourage more old people to move into the city, out, down from the mountains and into a kind of denser area with more services. But as long as there are people living on into their 90s in these places, I think there's a sense that they can't be abandoned. And so you've got to keep somehow providing services to them until there's nobody left. But it's not a sudden thing. You can't just turn off a switch.
Yeah, so that's true, but they're also then there and they need help and they're too far away. So TJ actually wonders about this, right? So recently there has been attention given to the gap between longevity and living well, right? So
Yes.
the last 8 to 10 years of life for many people globally are spent with, they're not easy. They're often bedridden.
Yes.
So can you speak to how these numbers play out in Japan? I mean, you had a data point in your article that made me go woo, which is that 20% of people in Japan over 65 have dementia.
Mm-hmm. Yeah.
Whether that's high or low, but that sounds a little bit high because the cutoff is 65 that jumped at me. And then 25% of people 65 and older in Japan live alone.
Oh, yeah. I mean, and there are various services that are popping up to address that. This is a good question. So I had the great fortune while I was in Japan, as you're right, by the way. I mean, there were months that went into reporting this story because I couldn't get to Japan because it was last year when things were closed. I spent most of the month of May there, but in the run up to that, I just did a lot of research and interviewing people over Zoom. But one of the people that I had the pleasure of meeting there is a guy named Yuzo Toda, who was the chief technology officer at Fujifilm, was instrumental in that company's transformation from a big conglomerate into medicine and pharma and more focused on engineering. He was very interested in this question. He was also the chairman of the Forum for Innovative Regenerative Medicine and on a number of boards. Sadly, he passed away in December. I hadn't even realized he was ill when I was speaking to him. He was very vital. And so first of all, there's a good presentation of him actually making these points and speaking to it in some detail. I can send the link, but he was very adamant about the need to connect longevity to healthcare, because if you don't do that, he said, all you have is sick care, right? And the other thing that he was very outspoken about was that he thinks Japan is too focused on the details. So on coming up with very detailed solutions, but not a systemic adaptation to increase longevity, not a national strategy or national leadership. So I thought that was an interesting comment. I do think that Prime Minister Abe was on the right track back in 2017. He started I think it was Council for Designing the 100-Year Society, where they were sort of starting to try to distill what are the best, because there's so many experiments going on. Okay, but what are the best use cases? What makes the most sense? What doesn't work? What should we stop doing? That was, I think, disbanded under Kishida. It's not active anymore. I think he wants to put his own stamp on things. But that said, the Living Lab platform that's mentioned in the story, there is collaboration going on there. There were about 180 projects underway last year. I heard overnight from someone at one of them at QTech, Kyushu Institute of Technology, that people are sharing best practices with one another. There are now consultation windows for both developers of nursing care robotics and for potential users. They're reporting their results to the Ministry of Health. I hope that these are, summarized and communicated externally as well. So I think we're in very early stages of this, and I was pretty clear in the story that robotics is not a magic bullet for reasons we can get into. I think I've wandered way off the question. Sorry.
No, that's great. And so this leads to, let's stay with the robotics for just one moment, and then I want to get into business. We're getting lots of great questions here, and I'm trying to group them, and eventually we'll have to go to what can we learn from Japan and that thing. But
sure.
Let's stay with the robotics for a moment. So there's this image, right, that Americans sometimes have that Japan is run by robots, which is,
ridiculous. Yeah,
not true. But there are in this living lab, in these various efforts, there are of course efforts to introduce robotics not only in Japan but maybe more here, to help turn a patient or to help do some things. And there's actually some research that shows that this is a study done in Germany, asking
Yes.
people, would you prefer to be cared for by a nurse or by a robot when it comes to these very, sometimes awkward or intimate moments? And the majority of people said, I'd rather have a robot do this. And so if there were a machine that could help me with that, I'd prefer that over over another person who is not a family member.
Yeah.
So the robot is not the solution, is where I'm going with this, right? So how does Japan think about this? Have you picked this up at all?
Oh yeah, I went way down the robotics rabbit hole. I talked to a lot of people who are at companies. Some of them are in the story, some of them are not. There are five key areas of nursing care robotics. There's moving people, transporting them into a bed, in and out of bed, walking aids, mobility, right? So people who can move on their own, toileting, no explanation necessary, monitoring and communication, and bathing, which important in Japan, lowering somebody into a bath. People don't want to be, many people, older people, I was told, do not want to be wheeled into a shower. They want a bath for cultural reasons. So there was a survey done, and actually I think it was about, I've got it here actually. I think it was about 9,000 of a total of 9,000 nursing care facilities. 80% used no robotics at all. Nothing. Right.
Really?
And then if you narrow it down more, 80%, 80. If you narrow it down to residential nursing care facilities, 1,600 roughly facilities, 60% were using nothing at all. So why? Well, they went into it. So as you can imagine, very detailed. The cost was one of them. Now, the Ministry of Health does subsidize nursing care robotics. The subsidies are not large. And one of the problems is they're not ongoing. So I went to 3 nursing homes, one which used a lot and one which used very little. And one of the issues is, well, okay, we get the robot and then it's partly subsidized, but then we have to train people to use it. And it takes time. And then there's maintenance, right? So that was a big factor. And then there were also a lot of questions about, is it effective? Is it useful? Is it more efficient than what we're already doing? And the Ministry of Health, I will say, they have relaxed the staffing standards, the night staffing, staff to patient ratios at nursing care facilities that have ubiquitous monitoring, so that they are, and there's more discussion going on about that to alleviate the labor problem, the lack of sufficient nursing care, people in nursing care, which, by the way, is not just a problem for nursing homes, but for the rest of the population. So in last year, 91,000 people left their jobs because they had to provide nursing care. And there's even a phrase for it. It's kaigo taishoku. So, quitting your job because you have to provide nursing care. When I was in Tokyo, I always like to look at what books are, I went to there's a whole section on nursing care, and I looked, and there was one book called Sarariman Kaigo. So I don't even know how to translate that, but I guess it would be like the working man, balancing work and nursing care.
The working man nurse.
The working man nurse. And it was all written by a guy who had to balance his job and taking care of a parent. And there's a term for that too, which is how to balance demands of work and taking care of a parent. And there's a whole program for that. So, the shortage of nursing care workers doesn't just affect staffing in nursing care homes, it affects overall labor productivity.
So we touched on the government briefly, but I think this could be a good moment to bring in who's paying for all of this. So John wonders that there's a mandatory public long-term care insurance system.
Yes.
Right, in Japan.
Yes.
But we had Margarita Estevez-Abe on the Japan Zoomina a few weeks ago, and she talked about the policies that are involved here, right, and who pays for what, and the different types of nursing homes. So we don't have to go there, but all of this is very expensive,
It's very expensive. Yes.
And the way it's paid for sets incentives. So you were just talking about robots, and they're too expensive. But so the government can shape this, right? So the government could make robots free and nurses expensive, or the other way around. That sort of thing. So what is the government? Does the government have a plan?
They do. I mean, and actually, what I'm looking at is this presentation here. And I'm sorry, it's all about, it's a Ministry of Health presentation about nursing care, nursing robotics, development and adaptation. Extremely detailed. I mean, every 3 years, the Ministry of Health apparently reviews the nursing reimbursement costs, and I don't think the next one happens till 2024. But obviously, subsidies for robotics adaptation is something it has increased. I think it's still rather small. There are also places where nursing homes can go to request consultations, et cetera. But in terms of who pays, I mean, the government, I had a great conversation with Hirotaka Unami, who was deputy budget director. Now he's part of Kishida's cabinet as a senior financial aide. And he talked about how, the long-term program, old people need to be more productive. And ultimately, the program needs to cover less, that in the past it was too generous, and that people were receiving far more in benefits what they paid, right? I mean, it's one of the most generous systems in the world, and it's financed by debt. So that's a problem. It's not sustainable. And I think there has been more. It covers, I believe, 70 to 90% of costs, and there has been more means testing in the past. When this insurance was introduced, people would just go to the hospital for a month until they died, and it was all covered. And that doesn't happen anymore. Post long-term. I'm sorry, this happened before the long-term insurance program was introduced. And then once it was easier to get services, right? Palliative care, et cetera. So you didn't just go to the hospital and stay for a month to die. But it's financed by the government at a tremendous unsustainable cost. And that's one of the huge challenges that this and future governments will have to address.
So since we're talking money, let's go to the happier side of this, which is the silver market, right? And so, which is, of course, a Japanese word for catering to the business needs of an aging society. But you make some really great points that aging is also a business opportunity, right? So, and there's not only for large companies to put an ESG or SDG sticker on some things, and that we can, but there's also dollars. This is real dollars, right? So you point out that Rakuten has started this thing where they give points for walking. So if you walk your Ichiman steps, which by the way is where this 10,000 step counter comes, so Ichiman steps, right? So 10,000 steps, you get a point, you can buy a book or something, or get a free music lesson.
And use it towards services.
Brilliant.
Yes.
Brilliant.
Yeah.
Hitachi has a very active program because they're actively pivoting. This is sort of my interest, right, into building the smart city of the future. And so, what is city tech, right? So, what's a community smart city look like? And so, they're investing in this. There's lots of startups in what you call H-Tech. I hadn't heard H-Tech, so I like H-Tech. So what are those? And then innovative burial options. You have a picture of this like futuristic looking, funeral home. So talk a little bit about business.
Yeah. So let me just say I have a strong point of view about that, especially having had the good fortune to have Japanese clients. So I think that Japanese messaging around ESG is too generic, especially when it comes to the S, right? Social. So everybody talks about what they're doing to reduce emissions and how to contribute towards mitigating climate change. I think that's just a given. Now, every Japanese company, or many, talk domestically about what they're doing to address aging society challenges. But they don't really talk internationally about that. Now, why not? I mean, I think it would be Japanese companies would benefit themselves by saying, for example, Japan leads the world in addressing aging, shrinking population challenges. Here's what our company is doing to contribute. And by the way, here's how that ties in with our core business. And I think Hitachi does a great job of that. Their app, it's a social participation app. It does a number of things. So yes, it records your steps, but it also kind of gamifies social participation. It gamifies getting out of the house. So every week, how many times did you leave the house? What did you leave the house to do? What level are you? Are you a beginner at social participation?
Like,
yes.
and 2 and 3.
Of course. Yeah, no. Are you really good at it, or are you just a novice? There's 4 levels. I love that. They partnered with a long-running 30-year-old gerontological survey. So there's a sort of good partnership there. They have a lot of aggregated data. Now, the Hitachi's, when I first talked to them, they had about 40 institutions, like companies and municipalities that were interested in this. Their goal is to sell the aggregated data. And I caught up with them just a couple of days ago, and they're now up to 70, and they have their first paying customer. So that's kind of interesting as a proof of concept. It also pushes information. It pushes information to them about how to be healthy, how to have healthy habits, right? So it's both kind of incentivizing and kind of gamifying social participation while also pushing information to them. They wouldn't tell me how many people have downloaded the app, which I understand, but that interested me because it's kind of in keeping too with Hitachi's shift again from a big conglomerate, kind of with lots of moving parts that was known for manufacturing, and now they're much more about engineering and data. And so the way that they're addressing aging society challenges is in keeping with their business, as it is for all of these companies, because that's the market that they live and breathe in, right?
Right. Yeah. And the whole age tech and the startup communities and I mean, some are kind of apps that look a little bit, really, can you do a little bit more? But there's some things that's certainly on the robotics side, and we also have a question on biotech. I mean, I don't know. I mean, the
biotech. Yeah, I have to say. So a disclaimer, or a caveat rather, is that my story did not address science at all, or medicine. So originally, this was going to be part of a whole issue devoted to longevity, and Nat Geo decided no, we want to kind of break it up. So there was actually a cover story in January about the science of longevity. This story was originally going to run with that, and they decided to run them separately. So I had to decide what I was not going to cover. There's a lot. Okay. And I didn't look at biotech at all.
Yeah.
I mean,
that's also that's complicated because there's all kinds of other concerns. Let's go to society. David has a really interesting question, so I'm kind of burning to ask you this. How's popular? So flipping the point of view, and so what is Japanese society thinking about all of this? And the question is, how is popular media like manga treating the elderly?
Oh,
like
yeah,
the 80s and 90s. Yeah, so in the 80s and 90s, he says, popular culture included the Obatarion, like the Obasan battalion, which marked the aggressive senior citizens pushing their way to the front, a little Obachan, right?
They're really loud.
So we're going ooh and ah over what Japan is doing for its aging society, but what does this look like in Japan? I mean, the young people it's enough of this already. Why doesn't nobody
Well, I did hear that. I mean, there is this push too. The government is sort of putting out the message, by the way, there's not going to be enough pension left for you guys, so you better save more, right? So they've got the NISA, these tax deductible, the savings accounts, but they're small. I did see posters up for them, but again, I wasn't focused on what young people think. I was talking to the old people, but it wouldn't surprise me if there is some undercurrent of, hey, what about us? Why do I have to hear about this all the time? I mean, at the same time, I did see someone showed me it was an online. I don't even know how to describe it. It's sort of an online tool that teaches you what it feels like if you're a person with dementia. So on this interactive thing, you get on a bus and you're riding along, and then all of a sudden you're not sure where you're going. And or you think you're back at your childhood home and you've gone the wrong way. And so there are efforts underway to try to create empathy especially as dementia becomes a larger and larger problem. But I don't know that I can speak directly um, to what does what does Japanese society make of this, except that the topic of aging is absolutely ubiquitous, and it's like the air that you breathe in Japan. You're just surrounded by it all the time.
Yeah. Well,
you know.
I think in Tokyo, I mean, we've all met the aggressive Obachan, and I always thought that the sentiment was she's earned it. She's had a tough life, and so
I think there is a lot of that. I think
she's on her bicycle, so make way for me already, right? So, but it's a very interesting question, right? Because if the society switches, I mean, there's a whole fertility policy programs that, but that's also kind of, okay, women, enough already with you fulfilling yourselves in the job, having children now. I mean, sort of, but that's a different story, and we can come back for that another time. But I could see how if the story changes, right, and the policy emphasis changes, that could also create some troubles. Although everybody has a grandmother who's old, so it's
actually, I mean, there's another aspect talking about business opportunities that I wanted to get into more detail, but I didn't have room to, which is insurance. Insurance is a really interesting window on society. So I spent quite a lot of time with Ioise, the insurance company, which in 2015 started offering the first policy to insure your property against the risk of somebody dying alone in it, which happens more and more. So if you're a landlord,
it depresses the real estate value tremendously.
Well, there are costs you have. I mean, it's kind of morbid, but there are cleanup costs if somebody dies in your property and is there undiscovered for days, weeks. So what was happening was landlords were increasingly reluctant to rent to older tenants, and so this insurance product was created. And then in 2021. They started offering insurance that covers the costs of your elderly relative wandering off. So for somebody if somebody over the age of 70 has dementia, it's dementia related, and they wander off, this insurance will cover the cost of search and rescue, of injury if they're injured, and even the cost of printing out and distributing leaflets. Have you seen my mother type of thing. So I thought that was really fascinating that there is age-related insurance, specifically in this case tied to dementia.
So this could be a good segue to a whole slew of other questions that we have from Andrew and others, which is about what we can learn. So Andrew says, my parents retired to this community of the golf course and whatnot, and when saw them, there was a lot of social isolation, which is pretty much in contrast to this much as a Cree thing. Since you've also reported on the US, he wonders, have you drawn any conclusions about what the US whether any best practices, and maybe more generally, what can other countries learn, Adam wonders, from Japan about increasing the quality of life, seniors?
Yeah, God, that's such a deep question. I think, again, I don't want to, as we were talking about earlier, we're not going to hype, robots. That's not the answer here. I do think isolation has become a theme here as well in America, right? Where we talk about deaths of despair. Now, the causes of that are different, and it's not necessarily an older population. But I do think that Japan is thinking a lot about and experimenting with ways to foster social interaction, social participation, and to combat isolation and loneliness. I think, now I'm sure there are also healthy habits. There was a book called The Blue Zones a while ago, right, about sort of a Japanese diet is healthy. So we can certainly learn to have healthier habits, but I think the kind of importance placed on not being isolated and on how do we get older people engaged. I suspect that there are things we can learn. I think there will be things we can learn about age-related technology. I just think it's early. And for example, here's an example, exoskeletons. So I went and talked to a company that makes them. You've probably seen them, but these sort of, or they call them muscle suits, right? It's something that you strap on And it was originally developed to help people who are lifting heavy things in warehouses. And now some nursing homes, not very many, are using them again to help lift patients. You put it on and it takes the pressure. It basically gives you added strength. It takes the strain off of your back when you're lifting somebody. I heard mixed things about it. Some nursing homes told me it's kind of a pain. You have to you put it on, you take it off, and you go do something else. And there are a lot of different companies who make them. So, maybe there will be a market leader in that. I just think that it's early. I think there's a lot of experimentation, but I think the energy that Japan is putting into it, I think the living labs concept and the attempt to really kind of curate best practices, I think that's something we could learn from. I mean, you don't want a government picking national champions, but you do want a government that can help, that can subsidize the cost of these, that can make it easier for nursing homes and also just senior citizens to become aware of what's available to them, right? And to maybe establish use cases and best practices. So I feel like that's starting to happen. It's only been a couple of years since this Living Labs platform started.
So I think Adam was maybe referring to a little bit more to our earlier Machizukuri story, and
the Machizukuri, yeah.
Whether there could be, I mean, if we wanted to transpose this into the United States, right? And first of all, Jim Fellows comes to mind, who has this wonderful line that, viewed from afar, the U.S. doesn't look so great, but if you go to the ground, Americans are actually pretty nice people. So I think I could see this happen somewhere in the middle of the country, that there are communities that would do Machizukuri initiatives. And by the way, your guy, the person that you were talking about, if I read it correctly in Kamigo, was himself a resident there for 30 years and now is 75 years old and is starting this, right? So this is old people creating a community for old people. But Adam was wondering whether outside of Japan this would work. Can we create incentives to serve and support the aged community?
Wow.
Is there something we
can do? I mean, it is a lot easier to create a sense of community when you're not diverse. Let's just be frank about that, right? I mean, Japan does not have, in large part, the multitude of cultures and nationalities and different countries of origin that we do, right? I mean, I think it's a lot easier to do in a population that's less diverse. And there may be, now I have to say, I didn't, and I'm sorry to keep saying, well, I didn't look at that in the story, but I was not focused on what's happening in the US. I was exclusively focused on Japan. So I do believe they call them naturally occurring retirement communities, or NORCs, in the US, and there's a whole body of research about that. All I know is that it exists. I didn't really have time to get into it, but for all I know, I think there are quote unquote intentional communities that are might be starting to happen here that are focused on the age, but I don't know.
Yeah, I think that this is happening. This is the next thing. It's becoming a thing. It's like 6 friends, getting property next to each other or something with a shared housekeeper and so forth. So I think that the learning could be more about just using the aging which is a fact, right? And we haven't had time to talk about immigration, which is also a whole another thing, because that really would, yes, it's necessary, but it won't solve this problem. So we could go back and forth on how important immigration is to solve this problem, but it isn't. The fact is that that's happening only very slowly, and so Japan is just basically addressing this as an opportunity to do something new and be innovative.
I do think Japan is better at facing aging. Well, they don't have any choice. We don't want to we don't want to think about it. I mean, books about aging here, I don't know that they sell well unless it's like How to Live to 100 or, we're obsessed. Miracle pills. We're obsessed with looking young. We don't want to think about aging. I think Japan is here's the one thing we can learn from Japan is confronting it and not trying to avoid it, and coming up with ways a multitude of ways to adapt it. Some of them involve tech, some of them don't.
So this kind of moves us to our sort of the larger kind of step back from the details of your very carefully researched article and talk a little bit about how we can view Japan, right? So when I talk to friends or people in the US, they really have this image that Japan is filled with old people and run by robots, and that's, you know, that's clearly not quite right. But Japan doesn't help the world understand better what it is doing, right? And you actually mentioned this. There's the you know, the nobility of failure, which is this.
Yes, let's get into that.
And the humility of success. So let's talk a little bit about what you think as a communications consultant, right? What would you think would be a good communication policy on this?
You're singing my tune here. So there was a quote in the journal today, I think it was in on the op-ed page, that messaging problems are almost always substance problems. From my experience,
yes, that again?
But messaging problems are almost always substance problems. If you have a problem with your messaging, it's because you have an actual problem. Like a friend of mine used to say, there are PR problems and there are problems. And usually when you have the latter, you need the former. So yes, but in Japan's case, I almost think there's a little bit of the opposite, where they have a lot of substance, but they don't know how to talk about it. There's a lot of experimentation going on. You mentioned The Nobility of Failure, which is a classic book about Japan, the tragic hero in Japanese history. That's the subtitle, by Ivan Morris, about the sort of long history of admiration for the noble hero who goes down fighting for a lost cause. And so I was thinking that we need a modern corollary, and maybe it should be the humility of success that maybe Japan needs. Japan doesn't like to brag about what it's doing well, but it should. I think Japan could think more broadly about talking about, for example, Japanese companies and the Japanese government, what's being done to address aging society challenges, not just within the borders of Japan, which is where the discussion tends to happen, kind of in a bubble, but that narrative should be aimed outward to the rest of the world. And by the way, to what will be a growing market for the products and services that are developed.
I think companies would
to
like
help people age.
My Japanese society is perfectly happy doing this at their own pace, and if you want to come and write about it, that's great. But they're not seeing a need to market this to the world. But so, why would it be important in your view that we understand this better?
Because we're all going down the same path. I mean, not in exactly the same way, but look at China. Their population declined for the first time since 1960, 1961. And by the way, there's way more interest in China than Japan in general. We can debate that, but this is becoming an issue for China that very rapidly. So they're moving up the scale of aging. The pace has picked up faster than anticipated, and that has, again, there are ripple effects from all of this. America, because of immigration, we aren't as affected, but Eastern Europe also,
or Germany,
other parts of Asia, Germany, Italy, Korea, yeah.
So I think this is a huge business opportunity, since Japanese companies have been at the frontier of those technologies, yes, and also social policies and these Machizukuri initiatives, and so I guess there's definitely a lot we can learn from Japan, and whether Japan advertises it or not, we should just all go and look and find.
Yeah, I mean, Jetro does have a directory of elder care companies that are looking to expand outside Japan. And some of them are exporting to Vietnam, the Philippines, et cetera. But if I was one of those companies, or even if not, just a big, Japanese household name, I'd be talking about it, because sure, you take it for granted. It's something you have to do in your home market, but the rest of the world's going to start needing it as well.
Sarah Loveman, it's been wonderful.
Thanks so much.
The hour went by in no time, so thank you very much. And everybody, thank you for joining us today and for your excellent questions that have helped us greatly and making this conversation deeper and broader. So thank you very much. Join us again in 2 weeks from now Takeo Hoshi, a professor at the University of Tokyo, will join us to talk about macroeconomic policies, a little bit different, and the policy choices confronting the next governor of the Bank of Japan. So with that, for today, thank you, everybody. And thank you again, Sarah. Terrific article. Thank you for writing it. And thank you for joining me today.
Thanks. It was fun.